Let's say you are sitting in your clinic taking a case and your patient is narrating the symptoms like extreme fatigue, extreme weakness, low blood pressure, so dehydrated, so much that now the patient is even unable to narrate the symptoms to you. The patient is dehydrated because of the diarrhea that patient has suffered from. Now the medicines like China, Camphor, Veratrum album, acid phos, and so many list of the medicines comes to your mind. But then you are confused. You are unable to catch those keynotes which your patient has narrated, and those keynotes are only the symptoms which are going to help you in your selection of remedy. There are list of remedies in your mind, but you are unable to select that one remedy which will help your patient at this point to feel better. Let's say you are an homeopathic student sitting in examination hall writing your Medica paper, and you have got very less time to revise the remedies. You have been asked about the differentiation between Camphor and Veratrum album for its collapse and shock symptoms. Now you are confused, unable to recall that PQRS symptoms of Veratrum album and Camphor that makes a huge difference between these two remedies, and when written will help you to score good marks. If you are one that who oftenly gets stuck and confused in these type of situations, and you are confused and frustrated because you are unable to give your best in this scenario, then this video is for you. Hello friends, this is Dr. Ritvi. Welcome to Homeopathy the Healing Power, and today we are going to study homeopathic remedy Camphora. Watch this video till the end to understand in depth about the remedy Camphora, so that if ever you are stuck in this type of situation, you will speedily find the solution of your problem. In this video, we are going to study in detail about the homeopathic remedy Camphor. We are also going to study those clinical conditions where this remedy can be prescribed, as well as that most important collapse condition and those PQRS symptoms of collapse condition where Camphor is indicated. As well as we will differentiate those symptoms of Camphor with rest of the remedies. As well as we are going to find that differentiation symptom between the Camphor and Veratrum album which make a huge difference in the selection of your remedy. As well as we will also see the rest of the other condition where Camphor can be prescribed. So watch this video till the end, and if you are new to our channel and if you have not subscribed our channel till now, then subscribe the channel, press the bell icon and select option all so that you will be get notified whenever a new video is uploaded from Homeopathy the Healing Power. As well as like this video and share this video among homeopathic students and new practitioners. So let's get started. Camphora. Camphora is prepared from the plant Laurus camphora, and this plant grows in Japan, China, Isle of Formosa. By cutting any part of the plant, a scent of camphor can be felt. This remedy belongs to the family Lauraceae. Camphora is one of the universal antidote in our homeopathic Medica. So any medicine prepared from vegetable kingdom can be antidoted with Camphora. This remedy specially acts on cerebrospinal nervous system, and also it acts on digestive system and on genitourinary system. Because it is an emergencycal, acute, short-acting remedy, the constitution of the patient while prescribing is not so important. But still, we can consider few points, and those are: the patient will be sensitive to cold air, the patient will have irritable temperament, the patient will also be physically and mentally very weak. As discussed earlier, that this remedy is for emergencycal cases, especially a short-acting remedy. So in emergencycal cases, this remedy is typically indicated for collapse, because Camphora has gained a lot of fame in treatment of collapse condition. So first of all, we will discuss the collapse of Camphora. Here we will see the pure picture of collapse condition which indicates only Camphora. So here in Camphora, the collapse is caused because of cholera, because of diarrhea, vomiting, and also Camphora is a well indicated remedy for shock. So here we will discuss the symptoms of collapse and shock simultaneously. The first and the foremost symptom here we are going to see is the icy coldness of the body. So in collapse condition, here now when the patient is dehydrated, the first and foremost symptom will indicate is the icy coldness of the body with sudden sinking of strength. That means the strength of the patient is going low and it's going low suddenly. On clinical examination at this point, we will see that the pulse are very weak and small. Here the most important symptom has to be noted, and this symptom is only the symptom which indicates Camphora in collapse condition, is that with icy coldness of the body, the patient will not be covered. This is the PQRS symptom of Camphora. Even though the patient is sensitive to cold, even though the patient is sensitive to cold air, and even though the patient is completely icy cold, still the patient will not desire to be covered, and you will see that the patient is right now uncovered. And on further examination, we will find that the face of the patient is very pale, anxious, a pure Hippocratic face is seen, where you see that the eyes are sunken in the orbits, there is dark circles around the eyes, dehydration is seen, along with that cold sweat is seen over the face. At this point the patient may have loss of voice, or if the patient is able to speak, then there will be a husky type of voice. The icy coldness of the body is so well marked that even the tongue of the patient is felt cold. The facial expression of the patient at this point shows a state of full despair, intense agony, and complete helplessness is seen through the face of the patient. The tongue, which is cold in nature, becomes flabby and sometimes it almost trembles. Along with this, we will find that there is insatiable burning thirst seen in this Camphora patient. On further examination, we will find that the skin of the patient is cold, pale, blue because of cyanosis, and here the patient cannot bear to be covered. Here in cholera, we will see that the patient passes rice watery stool, which are sometimes blackish in color or sometimes they look like a coffee ground. The patient passes involuntary stool, and the attack of this cholera is seen suddenly in the patient with rapid sinking of the strength of the patient, which makes the patient's body to extreme coldness with great weakness, and a collapse condition is seen. Camphora again is a very important remedy for shock, and here in shock it is typically indicated for asphyxia of newborns. Friends, what are those symptoms which makes a clear differentiation between Camphora and Veratrum album in collapse condition? So here in collapse condition in Camphora, it is seen that in the initial stage there is a sudden attack of cholera, vomiting or diarrhea, whatever may be the disease condition. So here will be a sudden passage of stool, vomiting or dysentery. And now there is a cessation of discharges. That means there is a sudden stoppage of all of this discharge, and then collapse condition is seen. So in the sphere of action, we have discussed that the Camphora acts well on digestive tract and on cerebrospinal system. So here in Camphora, The dehydration is not produced because of excess of passage of stool or vomiting or because of sweat. Here, the dehydration, the collapse condition occurs because of circulatory failure. Whereas in Veratrum album, we will see that there is a profuseness in all the discharge. That means whatever may be the type of the discharge, either vomiting or diarrhea or dysentery, there is a profuseness of discharge with more purging. And this excessive discharge produces dehydration and then collapse condition in Veratrum album. So Camphora is for sudden onset and for scanty discharges, whereas Veratrum album is known for its heavy discharges. As well as the another important keynote symptom to differentiate is there is an icy coldness of the body, yet the patient does not want to cover himself. Patient throws off all the coverings. In spite of the patient is sensitive to cold and cold air with icy coldness of body, but you will find the patient is uncovered. Again, this symptom differentiates Camphora from Veratrum album. So Camphora is not just limited up to collapse condition. This remedy is also indicated for infective fevers, where you will see that there will be chill stage with no thirst. The chill stage is little bit a long stage as compared to other rest of the two stages, with icy coldness of the body, sensitivity to cold air and desire for no coverings. In heat stage, there may be mild heat seen, again with no thirst, and in sweat stage, there will be cold exhaustive sweat seen in the patient. Also, this medicine is indicated for weird type of mania seen in the patient, mania with melancholy. Here the patient is seen with violent rage, and here the patient, during this mania, we see that the patient scratches, bites and tears her clothes, as well as foams are seen coming out from the mouth. The patient has a great desire to jump out of the window, and sometimes the patient even tries to attempt to do that. There is an fits of crying seen in the Camphora patient, and the mania is very weird, describes the mental agony of the patient. Friends, here are the important keynotes of Camphora which helps us to differentiate Camphora from rest of the other remedies. The first and foremost and most important keynote symptom is that here the patient feels ameliorated from all the complaints when thinking about that complaint. So as soon as the patient notices and starts thinking about that complaint, the complaint gets ameliorated. Again, this is an important PQRS symptom. Camphora can be used for low blood pressure. Here the remedy has to be repeated frequently. As well as Camphora can also be used after surgery if there is low temperatures of the body seen. Camphora can also be prescribed for first stages of cold with chilliness and with sneezing. As well as Camphora can also be prescribed for all the complaints that get arises because of cold climates. Also, Camphora is one of the great heart stimulant. So in emergencycal cases, if you find the symptom similarity with coldness of body, Camphora can be given with frequent repetitions. All the complaints of Camphora get worse from motion at night, by contact, in cold air, and they get better from warmth. Relation with other remedies. As we all know, Camphor is one of the universal antidote, so it antidotes all the remedies that come from vegetable kingdom. As well as Camphora is complementary to Cantharis. This remedy can be compared with Carbovage, Cuprum, Arsenic and Veratrum for its collapse condition. Talking about the potency, generally the tinctures are used with frequent repetition, as well as higher potencies are equally effective. So friends, this is all about Camphora. Please leave your valuable feedback and any suggestion in the comment section given below. Like this video, share this video and subscribe the channel to meet again. Thank you for watching.